Good morning or good afternoon. Uh, I'll start by introducing myself. I'm Christine Buru, a Kenyan lady who is passionate about health, how we can use ICTs to improve and to support home-based care. Currently, I'm a project manager at Medic Mobile, where we try helping expectant mothers in rural areas. So we create applications which are used by healthcare workers in rural area to monitor the expectant mothers and also children below 5 years. My presentation today is on how we can use USSD technology to support home-based care for HIV patients in Kenya. I will start by giving a brief explanation of HIV in Kenya. We can say that HIV in Kenya has evolved. The first incident was seen in 1984, and later in the 90s, the prevalence went high, up to 10.6, which the government intervened, and by 2003, the prevalence had dropped to 6.7. Since then, the prevalence has remained relatively stable because the government has involved healthcare workers, a lot of training, just to ensure that people all over Kenya have access to the information of how to take care of the epidemic. They have also provided, like in healthcare facilities, when people go visiting there, they're provided with condoms so that they can take safe sex for those who are sexually active. The pandemic affects all sections of society, but mostly it affects mostly the women and the children, especially in settings where, for example, in some rural Kenya, men are allowed to marry more women. So if a man, the first wife dies of HIV, the other women will be married to him, and obviously since they are not taking precaution, the most likely that the HIV will continue spreading to the other women, and the children born in that marriage will also be affected by the disease. So from the map, that's the map of Kenya, you can see in this Nyanza area, that's where HIV is so high, followed by Rift Valley. And also from down here, we can see the percentage. And as I've explained, why there's so much HIV in this area is because their culture allows them to marry several women. And when a wife dies, or when a wife dies, the man is allowed to marry other women. And in the case of a woman, when your husband dies, you are inherited by the brothers. So that results to the increase of HIV pandemic in this region. So there are some challenges which are associated with HIV pandemic, and they are listed. There's poverty. When you get sick, you're not healthy enough, so you're not able to work well, and in a result, you're not able to provide for your family, resulting to poverty. You can also say inadequate literacy. Like if you don't have information of how to take care of yourself when you're sick, if you don't have information of how to protect yourself from having the disease, that's a challenge, because you'll just infect the disease and you don't know what measures to take to maintain or to self-manage the disease. We also have the social culture settings that, like I've explained, where you are allowed to be married by several. You are allowed as a man to marry several women, or when your husband dies, you can be remarried by the brothers or the cousins. There's also poor infrastructure, like in rural areas, the clinics are so far. So when you're sick, you don't know how to get the information of how to manage the disease. There's also stigma and discrimination. in some area, when people notice that you have the disease, they try to discriminate you. At some workplaces, you'll have to fill a form and you'll be asked, are you HIV positive? If you're positive, you may not get the job, because they look at you and they're like, maybe most of the time you'll be out of work because of your illness. And now my area, which I'm mostly focusing on, is malnutrition, which results malnutrition. If you're not feeding well, that means that the disease will continue wasting you, whereby if you're not supplementing the nutrients to your body body continue becoming weak, and it might result, this is most, in most areas, this is what is causing early death, not even the disease itself, but malnutrition, because you're not supplementing the nutrients. So in the next, according to research, it shows that malnutrition, the nutrition intervention among people living with HIV and AIDS can help to self-manage the disease. And there's the linkage between HIV and AIDS and malnutrition are many, strong, and long-lasting. Nutrition is an opportunity entry for assisting affected communities to cope with the epidemic. And it has been seen that when nutritional care and support is taken, if the people living with HIV take care and support themselves with nutrition, they are able to manage the HIV and AIDS. And it has been seen that nutrition, some food which are readily available at home, can be used to manage the HIV-related symptoms, such as sore mouth, diarrhea. There are some nutrition which you're supposed to take to avoid such symptoms. And from this, we can see that good nutrition will help to regain your weight, and also it prevents the deficiency of micronutrients. And it also strengthens your immune system, which helps to fight the HIV. It reduces vulnerability, so if you eat healthy, you are less infected by the HIV-related symptoms. And this explains the nutritional needs which are met by specific food to manage the HIV-related symptoms. So in our question, we are asking, how do we handle the malnutrition among people living with HIV and AIDS? And we are saying in Kenya, the healthcare workers are doing a lot of training. People living with HIV visit the healthcare facilities, and they are given intense training on what to take to supplement the nutrients. They are also provided with food supplements. In case you are short in iron, you're provided with iron pills, calcium pills, just to supplement the food, supplement the nutrients, I mean. They're also provided with printed materials, which they can refer to when they're at home, on what to take when they don't have, what to take when they are affected by certain symptoms. Also, there are healthcare workers who volunteer to frequently visit the people living with HIV at home, and just to explain to them, maybe in their native in their language, on what they should take, what is readily available at home, what they should take to supplement to avoid malnutrition. So in my case, as an ICT4D researcher, I'm looking at how we can use ICT devices to handle this malnutrition among people living with HIV and AIDS. In the previous, this one, we are seeing it's all about word of mouth, printed papers. But now, as ICT researchers, how can we use ICT to avoid malnutrition among people living with HIV and AIDS? And what motivates us more to use ICT is that ICT has shown potential in health practices. And like in Africa, there's advance in internet and mobile computing, where in a homestead, you'll find that there's at least one mobile phone which is being used by that household. And we have seen that mobile phone, they can be used by even people with basic level of literacy. Mostly they use it just to call and to receive SMSs. So that's another motivation which has increased for us to use mobile application to support home-based care among people living with HIV and AIDS. So in my previous research, my master's research, which was also in ICT4D, specializing in mHealth, I developed a web-based advisory expert system, which was used by, the research was carried out in South Africa, Cape Town, South Africa, where we developed for them an advisory system which was being used by people in rural settings in South Africa just to provide them advice on what nutrients they should use, what meals they should take just to self-manage the disease. And I'll just show the screenshots of what was being used. The system could be accessed by most people that I was dealing with. They didn't have smartphones, so they were using their featured phone to access the system. And this was the term and condition page, where they had to agree that this system is just there to help them, providing for them advice of what they should take, and they should not supplement, they should not use it to substitute professional medical advice. It's just a way of advising them. After accepting the terms and conditions, the users were allowed to enter their personal details, which did not allow them to put their name, just to avoid, they say stigma. They don't like, people living with HIV and AIDS, they don't like providing their names and information. So the only thing we are asking here is just general information. Are you a female? What age? What level of education? We just wanted to see which people were mostly using the system. After filling the personal details, here is where they chose the symptoms they were experiencing, and they were supposed to enter the duration. And if the duration was more than 3 days, the system will provide an alert warning telling them that they should visit the nearest healthcare facility. It was an expert system, so it knew if it's more than 3 days, you should visit the nearest clinic for medical checkup. After filling this, the system will provide recommendation of what they should do just to avoid the symptoms they're experiencing. Like now, in this case, if the person was experiencing constipation, the system will provide this advice of what they should take to manage the symptoms before they visit the healthcare facility. So with this system, yes, it worked perfectly well, and most people used it in South Africa, but there was a limitation with it. To access this system, they had to use internet. And seeing that most of these people, they were from rural areas, most of them didn't have work, they couldn't afford internet. And from the information I got after the research, that was one limitation that I got. So to advance my research in this area, I decided to look at an alternative way that they could use that would improve this system. The system is already there, but how can we improve it so that most people, even in rural area, who are just using basic phone can use the system? And that's how I came up with my proposed technology, which is USSD technology. USSD stands for Unstructured Supplementary Service Data, which can be used by any phone as long as it has connection to a network. You can use the system. So the caregivers and people living with HIV can send a special number to request for a particular information. So to request for information, like in the other application where they had like to put a particular symptom, here they are supposed only to dial a particular number I'm in the early stage of the research, so I haven't developed the system yet. I'm in the initial stage. So I'm trying to see the number they can send. This is just an example. Maybe they send this number to the application, and the application recognizes the user number. In case maybe the healthcare workers will record each patient in a certain area. So with that number, the application will recognize that user number and respond maybe by saying, hello user, maybe a particular name. Let me use my name, Christine. Enter your patient number. So the application recognizes the submitted patient number and answer with a basic menu. A menu that will look something of the sort where you're supposed to fill, where you're supposed to fill something of the sort. That's what I'm planning to develop. After entering that menu, it will give you, it will provide you with a list of HIV-related symptoms, which when selected, the application provides the appropriate nutrition, just the same way as this one. After going through the menu, after filling the menu, it will at last provide you with such recommendation of what you should use to manage the symptom. Why I chose to use USSD is that it can be used on all mobile phones as long as it can connect to any network. That's one advantage. It's also cheap. In the previous research, most of them were complaining that they couldn't afford internet. But now this one, the only thing you need to do is just send the number. It won't cost you any, as the caregiver or the person with HIV, it won't cost you anything. And it's easy to use. It's just putting, as long as you master the number, you just place it there and follow the main menu just to access the information. It's interactive. From the menu, just asking you what symptoms are you experiencing. It interacts with you. You are able to interact with it so that you can get the accurate information. As I said, I'm in my initial stage of the research. So these are my research questions. Can the USSD application be an effective technology that will allow people living with HIV and AIDS to access HIV-related nutrition information via their mobile phone? So this is one question that I'll be answering at the end of the research. And how best can such application be accessed and effectively used by people with just basic ICT knowledge? I should answer that question as well. And will the application improve how the HIV patient self-manage the HIV-related related infection? So these are the three questions that I'm looking at, how I will go through my research. I'll go through my research just to answer these three questions. And the methodology that I'm going to use user-centered design, because I believe I'm building the system not for me, but for the user. So first of all, the user-centered design involves 4 stages, which is requirement gathering, requirement specification, design, and evaluation. So in requirement gathering, that all means I'll have to go to the field. I'll be using focus groups. I'll be using observation. I'll be using interviews with the healthcare workers and the people living with HIV just to get the requirement. Will they accept the USSD? How do they feel about the application? So that's what I'll do in requirement gathering. Requirement specification. I'll also work with the user. I'm creating the application for the user. So they have to accept what I have to do what they want. I have to design a system that they will be comfortable to use. So requirement specification, I'll have to go back to the field and work with the user to refine the requirements and get exactly what they need, what I need, so that I can design for them the system. Design here, Also, I'll have to work with the healthcare workers and also people living with HIV. In this case, that's where I use prototyping, paper prototyping. That's the initial stage where I go to the field, sit down with the healthcare workers and people living with HIV, sketch the diagrams of how the system, the workflow of the system from the initial stage of entering the number to the main menu being provided and how the system will be interacting with the patients so that they can get the accurate information. So in design, I'll be using paper prototype and also wireframes to refine my design. Evaluation. After designing the system, after designing, then I'll have to code to come up with to refine the already system that I have so that I can incorporate USSD technology. So, and then evaluation, I'll have to go back to the field and ask them after using the system what challenges they experience and what need to be refined. These are the stages I'm going to follow. And the anticipated outcome, we expect to implement a mobile application that utilizes the USSD technology. The application should be accurate and easy to use, provide simple instructions that a user follows to access the required nutrition information, and as academically, the outcome will include a contribution of knowledge in mHealth research, published papers, and eventually a thesis. Thank you.
Your research is about using mobile phone to get the information if there is any cure of HIV or this kind of information.
Yeah.
I'm wanting to know about if someone sends a message to the information center, how they will reply to the message. Is there will be a database so that the user will send a message and tell them this is my symptom, what shall be the suggestion of this information, or a doctor will be there to prescribe by going through the records of this patient?
Okay. Initially, what will happen, like in my previous research, what you do, you first go to the people living with HIV and AIDS. They always have session at the clinic, maybe like every Tuesdays, where they go, they are being trained what to eat, what not to eat. So those training sessions, they are conducted manually. That's why in my presentation I showed you they are trained, they are given printed materials. But now we need to automate this for maybe in case I'm at home, I'm experiencing a certain symptom, and the clinic is far. I don't have to go all the way to the clinic. I can use my mobile phone. So what will happen, information of these people living with HIV and AIDS will be collected. Their mobile phone will be collected and will be added in the database so that when you send us that special number, the system will acknowledge, it will know this is Christine maybe sending from certain village, and she needs to access this certain information. So immediately you send the information, as long as you are among in our database, it will recognize you. Then it will interact with you just to ensure, to ask you questions, what symptoms are you experiencing? Then from the menu, you will respond to it. You'll pick the symptom and send to the system. Then after you have sent the information, it will now give you remedies, like the one you have seen. And as I said, it's just advice. It's a way of self-managing the symptom before you go to the clinic. So this is not like replacing the professional advice. It's a way. Maybe you are in the deep rural and you need to self-manage the symptom before you go to the clinic. So these remedies are just there to self-manage before you visit the clinic. Have I answered your question?
Yes, thank you.
Okay.
Any more questions? Yes, a quick one. Okay. So you are saying that you want to undertake this research. Okay. So I want to ask you about, let's say, research partners or people with whom you intend to work with, so that I ask you the other question.
I've already identified a group in Kilifi. Kilifi is in the coastal part of Kenya. Those are the people I'll be working with.
Okay.
Who are they?
They are like mostly I work with the clinic, healthcare facilities. You go attend their trainings and listen to what advice they are provided to by the healthcare workers, because they are like healthcare workers in that region. Volunteers who visit the patients in their homes, just providing this information, and who train them also in the clinic. So those are the people I'm working with and the people living with HIV and AIDS.
Okay. So which means that they have also elaborating a list of remedies. So in the case of a database.
That one I already have, because as I said, it's a continuation of my research. So all that information, I got it from the Ministry of Health, the remedies and the symptoms, how to take care. All that is already in the database. The only thing I'm trying to change is that the previous research, I was using an advisory system, a web application. Here, I just want to use an USSD application. So that's the only transition.
I'm afraid we are behind the schedule.
Yeah.
We could take the questions in a break.
Okay.
Let's have the last presenter before the lunch break.